You know, Brandon, we can talk about the clinical side of our work all day. The precision of the surgery, the technology we use, the biological process of healing, all of it is incredibly important. But none of it really comes to life until you see the result through a patient's eyes and hear it in their own words.
That's the absolute truth, Russ. The true measure of our success isn't just a perfect postoperative x-ray. It's seeing a patient's life tangibly improve. Hearing from them months later about how they're doing, that's when we get to see the real, lasting impact of the care we provide. It's about the results.
It is, and we are incredibly fortunate that so many of our patients have been generous enough to share their experiences. Welcome everyone to Oral Surgery Insights. I'm Dr. Russ Lieblich, and I'm here with Dr. Brandon Rare. Today, we want to step back and let our patients' stories lead the conversation as we discuss the life-changing transformations we are privileged to witness.
Our hope is that by sharing and exploring some of these common experiences, listeners who might be in a similar situation can feel more hopeful and confident about their own potential journey. These stories are a powerful reminder that there are effective solutions to even very complex dental problems.
Let's start with one of the most comprehensive transformations we facilitate, the full arch restoration. This is for patients who may have been struggling for a very long time, often without any teeth at all. We recently heard from a patient named Connie from Woodburn who was in that exact situation. She came in feeling, as she said, a little apprehensive, having been without teeth for quite some time.
That's a very common and difficult situation. A full arch restoration is a significant procedure, and it's completely understandable for a patient to feel that apprehension. Our first job in these cases is to build trust and create a sense of safety. The clinical goal is to use dental implants to support a permanent, fixed set of teeth.
And the impact on Connie was profound. Her words were, "I couldn't even imagine it being this good, and this has brought me a lot more courage and self-confidence. I find myself smiling so much more." That feeling of it being better than imagined is what we always strive for.
And that outcome is only possible because the underlying foundation we build is so stable and secure. The reason a patient like Connie can feel that confident is because a full arch restoration on implants restores chewing function to a level that is very close to that of natural teeth. That physical stability is what directly creates the psychological confidence she's talking about. It's not a cosmetic illusion, it's a functional reality.
It is. When you no longer have to think about your teeth when you speak or eat, it frees up so much mental and emotional energy. Many patients who have been without teeth for a long time experience a degree of social isolation. They modify their behavior, they avoid certain foods, they hide their smile. Connie's story is about regaining the social freedom and courage that had been diminished by her dental situation.
Now, not every case is a full arch restoration. The impact of replacing even a single tooth can be just as profound, and the experience of the process itself is just as important. We heard from another patient, Robin, who came to us for a dental implant.
And what stood out in Robin's story was her focus on the communication during the process. She mentioned how our staff was cheerful and put her at ease, and that the doctor took the time to explain things by actually drawing pictures for her.
That's such an important part of patient care. Taking a few extra moments to ensure a patient has a true visual understanding of what's happening demystifies the process. It moves it from something abstract and potentially frightening to something totally manageable. It's a key part of the informed consent process.
It's about translating complex clinical information into something that just makes sense to anyone. That simple act of drawing a picture immediately lowers anxiety because the fear of the unknown starts to disappear. It shows respect for the patient and builds a powerful therapeutic alliance.
And it's no surprise that this leads to a better experience. Robin said her procedure went better than she expected. That is always our goal. When a procedure feels easy for the patient, it's usually a direct result of the meticulous, detailed planning we do beforehand, along with years of experience. Most procedures only take a few minutes, and the predictability in planning leads to a smooth surgical experience.
Her final reflection was, "My quality of life has improved immensely. My face feels good. It made my smile better." It's a wonderful summary of how restoring even one part of the mouth can improve a person's entire sense of well-being.
We also hear a lot from our younger patients, often about their experience with wisdom teeth removal. This might be their first real surgical experience, so managing their anxiety is key. We received feedback from Dakota, a young man from Vancouver.
Dakota's story really highlighted the importance of a welcoming environment. He said he had a great first warm impression and that the staff made him feel welcome. For a younger patient, that initial feeling of safety and friendliness is so important in shaping their future perspective on healthcare.
He also mentioned the value of our video messages. These are short, animated videos we send to patients before and after their surgery, explaining what to expect in a very clear way. Dakota said they made him feel more relaxed and calm about what was going to happen.
Another patient, Ben, who came for an extraction, also mentioned these videos, saying they really put his mind at ease. This is a great example of using technology to enhance patient communication. It gives patients and their parents a tool they can review at their own pace, which reduces the stress of trying to remember every detail we discussed in the office. It empowers them with knowledge.
And the outcome for Dakota was exactly what we aim for with these procedures. He described it as in and out and said his recovery was awesome. For a young, active person, an efficient procedure and a smooth, predictable recovery means they can get back to their life, school, sports, work, quickly, and that's a huge win. Our goal is to make necessary surgery a minimal disruption to their busy lives.
Sometimes the procedures we do aren't about teeth at all, but about addressing other issues, like pathology. And often this involves treating children, which means our primary focus is on building trust and providing reassurance to their parents. We heard from Alex, the mother of a young patient named Connor, who needed a cyst removed.
In these pediatric cases, the parents are our patients too, in a very real sense. Alex mentioned that she found Dr. Rare to be very smart, which is important, kind, patient. That combination of confidence in our expertise and feeling that we are compassionate is what every parent is looking for when their child needs surgery.
She also noted something that is a standard part of our practice but is so meaningful for parents. She said Dr. Rare even personally called me himself after the procedure just to make sure Connor was doing great.
That simple follow-up phone call is so important. It's not just a courtesy, it's a critical post-operative check-in. It allows us to ask specific questions about how the child is doing, to answer any last-minute questions the parent might have thought of on the drive home, and to catch any potential issues at the earliest possible stage. It's a vital part of our safety protocol and our commitment to continuity of care.
It is. It closes the loop of communication for the day and reassures the family that our care and concern for their child continue long after they've left our office. It lets them know they're not on their own, and that support is just a phone call away.
These are just a few examples, but as you listen, you start to hear a common theme emerge. Whether it's a complex full arch restoration or a more routine extraction, the patient's experience is shaped by both the clinical excellence and the human side of the care they receive.
It truly is. A patient like Ben, who came for an extraction, summed it up when he said the team made him feel like I was part of the family. When patients feel that level of comfort and trust, their anxiety diminishes, and their entire experience is profoundly more positive. Even for a single extraction, he noted, my quality of life has extremely improved since the surgery.
That feeling of being part of the family doesn't happen by accident. It comes from deliberately building a practice culture and training our entire team, from the front office to the surgical assistants, to prioritize compassionate communication, and to always see the person, not just the procedure. It's an intentional part of how we practice.
And that positive experience can have a real beneficial impact on their physical healing process. When a patient feels safe and cared for, their stress levels are lower, which is better for their body's ability to recover. That's the power of the human side of medicine.
It is truly the most rewarding part of what we do, to hear these stories directly from our patients. It reinforces our commitment to providing not just excellent surgical care, but also a compassionate and supportive experience from start to finish.
We are so grateful to Connie, Robin, Dakota, Ben, Connor, and the many other patients who take the time to share their journeys. Their stories can provide so much hope and encouragement to others who might be in a similar situation and feeling uncertain about what to do.
For our listeners who might want to see and hear more of these powerful experiences for themselves, we have a dedicated section on our website with many of our patients sharing their stories in their own words.
We absolutely encourage you to visit. You can see these real patient stories by going to beaconoms.com/video-reviews/. It's a wonderful way to understand the real-world impact of these procedures from the people who have experienced them firsthand. Thank you everyone for joining us today for this special episode of Oral Surgery Insights.
We appreciate you listening, and we trust that hearing these stories has been as inspiring for you as it is for us every day.
We wish you all the very best.